Good afternoon. As always, thank you for joining us today. We appreciate your patience and tolerating a slightly delayed start time, but we do have a lot to get through. So, get through not just data, not just a bit about the regional stay-at-home order, of course, about vaccines, a focus on surge and activities, especially in Southern California. And then we'll end with an update on our tiers, as we do on most Tuesdays. So if we can begin with the first slide. So we've been talking through, and of course, there's been tracking our cases closely. We've had this 7-day average of 42,136 cases, and yesterday reporting a lower number at 36,487. This is promising news, of course. We've been talking about the hope that we'd see lower post-holiday surge than we did see post-Thanksgiving, and we're beginning to see indications that that's actually the case. This is in the face of what is a sort of average number of tests that we've been doing as of late, 337, nearly 338,000 tests, and a slightly reduced 14-day positivity down to 13.5%. Good news here is believe it's really stable, bouncing up and down a little bit as we always see, but stable overall, which is much better than what we've been witnessing, which is a pretty radical increase on that test positivity. Next slide, please. Again, looking at the 7-day versus the 14-day, they're even today. I think it's promising that we're seeing the 7 days at least as equivalent or hopefully going to be better soon versus the 14-day. That means that we're in a downward trajectory versus an upward trajectory when you see those reversed. Again, a smaller increase, 7.1% change over the last 2 weeks. Another signal that we're seeing, even though things increase, it's a lower rate of rise, which is good news. Next slide. Here we talk about the COVID hospitalizations. I think many of you are tracking them. 21,747 individuals with COVID currently hospitalized in California's hospitals. That represents a 5.5% increase over the last 14 days. The last time we had a rate this low was actually the end of October. The middle of October, we were actually seeing decrease in hospitalizations. Around the end of October, we saw about a 9% increase. And since then, it's been higher and higher. Today represents a fairly low level of increase overall in our hospitalizations. And again, around our ICU numbers, 4,854 individuals in our ICU, still a 10.6% increase in the past 14 days. But yesterday, we actually reported 11 fewer individuals in our ICUs across the state for COVID than we did the previous day. Again, 11, not a big change, but important that it doesn't keep going up, which is one of the early signs that we want to see as we hope and trend towards improvement. Biggest signal to me that things are beginning to flatten and potentially improve is that around the 5th and 6th of January, we were seeing on average 3,500 new admissions for COVID across the state. Over the past couple of days, we've been in the 2,500, 2,600 range for new admissions. And that reduction of nearly 1,000 admissions is shared across the state. So it's not a reduction just in the Bay Area or the greater Sacramento area, but it's also being experienced in San Joaquin Valley and Southern California, which I think is really good and important news for those regions. Next slide. So before I go here, I want to just mention an important milestone that is a sad milestone that the state has reached. And despite some of the early indications of positive news, we know that death is the lagging indicator with COVID. It's one of the last things that we see rise. And we have seen over the past week and a half, high numbers of deaths day over day. And today we do cross 30,000 deaths since the beginning of the pandemic as a result of COVID, an important and sad milestone. Want to recognize all of the families and communities that have been impacted by those deaths. We continue to work hard to save lives, to lead by saving lives, to make decisions both on how we handle our blueprint for reopening, how we manage surge and deploying resources, and again, as we get to vaccines, focused on saving lives. But a never easy to forget reminder are those death numbers of how serious this disease is, how serious the pandemic is, and how the responsibility each of us holds is so important to really bend that curve and bring this pandemic to an end in California. So as I said, our whole focus on surge continues to be about saving lives, that we've taken interventions, things like the regional stay-at-home order, a new public health order last week to help support counties and hospital systems to work together to make sure that the impact in one facility is supported by the actions and activities of the broader set of hospitals in their community. Again, all pointed towards saving lives and reducing the impact overall on our state. Next slide, please. So getting specific, just reiterating, we moved down from about 3,500 admissions per day to 2,500 admissions per day. That's a pretty significant decrease. We hope to see that continue. Although I will say, post the holidays, we saw this towards the end of the year, last year, early this year, we had a significant number of high case days, and those cases will have already begun, but will continue to be admitted into our hospitals for the days to come. So we keep looking at the data, but these are encouraging early signs. The state has taken steps to support counties and regions most impacted by the surge in hospitalizations, and these actions have allowed us to decompress hospitals in some of our most impacted communities and to serve patients and those communities and save lives more effectively. I think some of the stories of communities so deeply impacted, whether that's the 911 system and ambulances, hospitals with extremely long waits, and other issues for other conditions, not just COVID, but heart disease, diabetes, strokes, other things that we know need hospital admissions, that some of the issues faced in the weeks past are beginning to be improved, in part because of the reduction of cases, the demand for hospitalization, but also because some of the actions the state, collaborating with our hospital partners, collaborating with our county partners, and many, many others have done over the past many days. Next slide. So to be more specific, the focus of the state was and has been in Southern California and San Joaquin Valley, in particular Los Angeles County, home to more than 10 million Californians. They have been particularly impacted with tremendous rates of spread of the disease, not just right around Thanksgiving, but a little bit before Thanksgiving, punctuated by that post-Thanksgiving surge in cases. And we knew then, as we entered the regional stay-at-home order in some of these regions, that we would see a difficult second half of December, first half of January, still bracing for significant impact in the weeks to come. But certainly some of these actions that I'm going to walk through have helped blunt that surge, reduce the impact. Ambulance traffic, for example, was redirected from hospitals who were out of capacity with long waits to hospitals with capacity, an important typical strategy that our emergency medicine leaders in counties use frequently, something called diversion, putting hospitals on diversion successfully, making sure that patients don't go to a place that is so deeply impacted when another facility is available a little bit further away, but able to provide care at the level we all expect. Since New Year's Eve, after working hard with hospitals, the counties, as well as our various lower level of care providers across the state, been able to discharge over 400 patients to those lower levels of care that are more appropriate for the care that those individuals need, helping them leave the hospitals, which are full of risks being in a hospital, especially during COVID, and allowing them to get to those lower level of care sites, and allowing the hospitals to be able to provide care to new patients awaiting care in the ED and other areas, so we can serve their needs better. We talked about the issues around oxygen. Tremendous amount of work. I'm just so grateful to our federal partners, Cal OES, a number of the departments in my agency, OSHPD as one, who've really helped to work with individual facilities on issues of oxygen, helping them increase the availability of oxygen at a facility, making sure essentially the oxygen plumbing was working as well as it could and provide the level of oxygenation that patients need, but also working on home oxygen, making sure that we have the canisters and the providers to be able to provide it, so individuals who can go home, safely home with oxygen support, could do so they aren't in the hospital, and we can use those scarce resources to serve other patients. Next slide, please. Just sort of continuing on, deploying more than 2,000 medical professionals across the state, many. Could we go back to the prior slide, please? There we go. So deploying more than 2,000 medical professionals across the state, making sure that we have as much as we can from out-of-state resources, Department of Defense resources, ensuring that we get those medical professionals to the areas most impacted, so largely San Joaquin Valley, Southern California focused, continuing to deploy another 1,000 medical professionals in the days ahead. Just in this week alone, increasing today, about 170 new staff arriving to the state, and in the days to come, even more than that. We stood up alternate care facilities to care for less critically ill patients. We have these strategically deployed. We've had them since the beginning of the pandemic, only now we're using them in a more significant way to serve certain populations. And these aren't just alternate care facilities as we had set up early in the pandemic, but it also includes building more capacity in existing hospitals, some efforts in Los Angeles County, in Riverside County, in San Bernardino County, in San Diego County, to augment the beds available for patients who need critical services in those facilities. We've always said better to support an existing hospital campus to increase their ability and capacity rather than build capacity, let's say at a fairground or a non-health campus area. That's pretty clearly obvious why. The ability to have all the critical supports, X-ray, other radiology, pharmacy, food services, all leveraging those on the campus. So really building that up as a key strategy and making sure that instead of delivering health corps and other types of state sponsored staff to those alternate care sites, working with the hospital campuses to get registry staff, other contract staff as a key strategy in our ability to support surge. The last bullet here is something that I'm proud of our team working on. We know that there's many assisted living centers or other residential care facilities for older Californians that don't have the capacity to deliver support like oxygen and some lower intensity, but still important nursing services. So creating a handful, 2 handfuls actually, 10 residential alternate care sites to allow individuals who maybe need more support than they can receive at their existing facility, but don't quite need hospital level care to be served in these sort of medium alternative care sites that we have stood up. Today, one in Los Angeles has 30 patients, and we have capacity to add over 100 more across the state. These will be built up in some degree over the course of the next many weeks as well. Next slide. So again, what can we do? And I'm giving you a message today where there is some hope. There is some reduction in the cases that we've seen. That I always say the hospital numbers don't lie. Even when testing might be delayed, we might be concerned that the test turnaround time is slowed. None of that exists now, but for me, always hospital numbers don't lie. People come to the hospital, they get the care that they need when they need it because they're that sick. And so to see a reduction in our hospital numbers in the last week to 10 days in terms of the rate of rise, I think is a very encouraging sign, but we're not out of the woods. We know that there's still a lot of COVID in our communities, and people can easily transmit it. I say that if you give COVID an inch, it will take a mile. So we must continue to keep our guard up. We must continue to work together to do what we can to reduce transmission. I know people are tired. I know it's exhausting. I know there's the hope of the vaccine, which should really help our ability to get through this pandemic, through this darkest period in our tunnel to the light. But there's still more that we need to do. So as much as I can encourage you to keep considering wearing your mask, doing the things like staying at home when you can, I think it's very important to help us through this period of time. And again, all focused on Californians coming together to save lives. I know we've had a tremendous sadness around the number of lives lost recently. And as a state, we continue to be one of the leaders in deaths per capita, and something that I know we can continue to lead in even despite this incredible surge that we're getting through now. Next slide. So focusing on a little bit of that light at the end of the tunnel, the governor boldly put out the goal to more quickly than we have before, get to 1 million more vaccines by this weekend. We are deep into that effort. We are working with counties, with health providers, with lots of labor and business partners to make sure that this happens, and working through that. It's an all hands on deck effort, not just by the traditional public health leaders, but all those that I just mentioned, a focus particularly on healthcare workers and those in long-term care settings, especially older Californians who live in those long-term care settings, to allow them to quickly and safely get vaccinated. There's a special effort focused on not just frontline healthcare providers, but all those who might join the effort to get vaccinations across our line. We say that a focus to vaccinate the vaccinators. That means those people like our dentists and our pharmacists and our primary care providers and our other specialty care providers, and not just the doctors and nurse practitioners and physician assistants, but all of their teams, the nurses, the LVNs, the techs, the phlebotomists, everybody who's involved in helping us support not just COVID care, but this effort to vaccinate California. And then a focus on new large-scale vaccination efforts coming up throughout the week. Some of those already started in the far southern part of the state in San Diego, and more to come tomorrow with the governor in the northern part of the state, and many more in between. Next slide. So last week, the governor asked, in a bold way, joined a few other governors to ask the federal government to release more vaccine. California has spent a extraordinary amount of effort planning to really create a structure that allowed us to stay focused on risk and exposure and equity all together. The various groups that we've brought together, the drafting guidelines work group, the community vaccine advisory committee, the scientific safety committee, all of these working so that California could create a structure that allowed us to be focused on vaccinating those first who had the most high risk and the most exposure, and then moving on to our general population little by little after that. The truth is, with such limited supply of vaccine and little bit coming into the state, we continue to look at ways that our structure allows us to get vaccine out to those populations as quickly as possible, while still allowing us to, unimpeded, finish the vaccine that we've already received. We have a saying that we want to be a state that vaccinates as quickly as we get the supply in. And we've been working on that, seeing that coming, seeing the potential move over the last couple of weeks to a more flexible prioritization list not just at the state level, but at the federal level. We have been exploring different ways to work with our partners to get that vaccine, not just allocated, not just in freezers, but actually out of the freezer, into the syringe, into the shoulder of many, many Californians, so we can begin to experience the benefits of that protection. As many of you probably have heard, today there was a early morning conversation between the federal government and states about further loosening some of those guidelines around who should be vaccinated, looking at some more details around age and other risk factors that might create higher likelihood of bad disease. The governor has immediately directed us to bring together our drafting guidelines work group, our community vaccine advisory committee. Those communications have already begun and will go throughout the day so that we can evaluate the new federal guidance, determine how it's going to impact what we do here in California, and with haste, without delay, getting that updated guidance out. Expect that will come, next 24 hours or so we can let all Californians benefit from the additional provision, not just of guidance, but we hope vaccine also from the federal government. And where does that all get to take place? As I mentioned, some large-scale vaccination sites already in the planning: Dodger Stadium, Petco down in San Diego, Cal Expo up in Sacramento, and Disneyland, of course, in Orange County. So these are examples of planned sites. We expect many more over the weeks and months to come as we recruit additional staff, additional other workers to help with the vaccine efforts. It's not just nurses and others, EMTs, pharmacists to actually do the vaccination, but it's a whole host of people to help on the administrative side and documenting, so we can track who's received their first vaccine, when they need to come in the second. I think given the level of surge and the focus on keeping our healthcare workers in our hospitals, in our clinics to provide care to those with COVID, we are recruiting many more people, as you've heard over the past days, to help us on the vaccination effort in these sites, but also continuing the work in those medium and small size vaccination efforts as well, whether that's in a small clinic practice in a county in the state, or one of our large hospital systems like Kaiser or Sutter or the UCs or Stanford, or one of these larger systems that also are not just vaccinating their staff, but beginning to vaccinate their patients as well. Next slide. So we've been many weeks now since the regional stay-at-home order was put into place. I'll remind you that the order required that regions, we had 5 of them, stay in the regional stay-at-home order for at least 3 weeks, and that the trigger to come into the regional stay-at-home order was when you had lower than 15% available ICU capacity. Of the 5 regions in the state, 4, the ones you see here, the Bay Area, Greater Sacramento, San Joaquin, and Southern California, were all put under the stay-at-home order, the regional stay-at-home order, that we committed to, after 3 weeks, to begin running projections to see where your ICU capacity in one of those regions 4 weeks out. So not today, running today's calculations, but what do the ICUs look like in 4 weeks? Because we know today's cases, today's sort of transmission environment is going to end up in the hospitals in a few weeks, about 4 weeks out. So looking at that projection to determine at what point do any one of these regions come out of the regional stay-at-home order. Currently, all 4 regions are remaining under the stay-at-home order, but we are actively calculating some of the information from the last 24 hours and maybe updating you in the next hours, and certainly by tomorrow if any one of these regions does indeed emerge out of that regional stay-at-home order. Next slide, please. So what happens when a region does come out of the regional stay-at-home order? We revert back to our blueprint for a safer economy. This is, I think, week 19, but who's counting, of that blueprint for a safer economy, using this as a strategy to move counties through a reopening process that's based on a couple of important factors, the transmission rate, that case rate, as well as test positivity. Remember, we also have a health equity measure that allows us to work with our counties to make sure their targeted effort to reduce transmission and test positivity is focused on communities in areas or communities that have had a disproportionate impact of COVID on the entire on the entire community itself. So today, without the release of a single region, we're reporting that Trinity County is moving from purple to red. That's widespread to substantial. That's a sort of less restrictive move. But we also announced a couple weeks back that Humboldt County moved from purple to red today, given that they're really in a part of the state that has significant transmission. It's really not surprising, if you will, that Humboldt County moves from red to purple as well. So the final count is 54 counties remaining in purple, 3 in red, 1 in orange, 0 in yellow. And if counties that emerge out of the regional stay-at-home order, based on where they're assigned today, they will go immediately into that tier in the blueprint as soon as they're out. Next slide, please. So as we've said before, together we can stop this surge. We know that as the rate of transmission has gotten stronger, we have too. We did put the regional stay-at-home order out just over a month ago. We have seen the effects. We knew that because of so many factors like fatigue, the ability to the difficulty of getting good significant compliance, but we did see some transmission reductions, and that is exactly the kind of relief our hospital systems needed to get through the last week, and we hope it will carry forward a little bit longer, but we are prepared and anticipate that some increase in hospitalizations will come in the middle of the month. We're just hopeful it's not as significant as we expected, and certainly not as significant as it would have been had we not seen these reductions in transmission, in part because of that regional stay-at-home order. Next slide, please. So I think this is where we end. I know that was a lot of information fast. I really do look forward to answering as many questions as we can get through today. So I'll turn it over to you to bring the questions from the reporters. Thank you.
Ana Ibarra, Cal Matters.
Hi, Secretary Ghaly. Thanks for taking my question. Earlier today, Secretary Azar announced that in 2 weeks, vaccine allocation will be based on a state's 65 and over population and their vaccination pace. I know you said the state is still looking over these guidelines, but I'm wondering, the state has a large 65 and over population, but it's also had a slow rollout so far. So would these changes help or hurt California? And given the guidance and the fact that the state now has large vaccination sites, could this prompt the state to open vaccines to all seniors 65 and over rather than divide seniors into different phases?
Yeah, I mean, this is exactly the question that the team's looking at today. I say that the guidance from the federal government that didn't just bring, hey, focus on 65 and older, but also some recommendations and some prospect of getting additional vaccine supplies over the days to come. In some ways, having more vaccine in the state is going to make the distribution easier. California has always stood up strong in the face of flu and getting vaccines out there quickly to lots and lots of Californians. This is not the same effort as a flu vaccine clinic. There's a lot more intricacy, 2 doses, more of a monitoring time per person who's getting the vaccine. So a number of wrinkles and complexities that are important. But I believe, and I think we believe, that having more vaccine, inviting more to be vaccinated, will allow California to go faster and quicker through our population and get that vaccine out of our freezers and into our population to get that protection. We do expect, though, over the next 24 hours, and I'm really proud of the work of all of the groups have come together to think about not just a risk and exposure-based formula for getting vaccine out, but one focused on equity. So how do we keep those key principles in place while also acknowledging that today. It's not just about vaccinating for the middle and long term, but it's about getting people vaccinated who can, because they're lower risk of getting severe disease, can actually become help to our hospital delivery system that needs some relief. We know that for every older Californian who gets infected, that they become more likely to need a hospital stay and maybe have the worst outcome of death. So making sure that we're focused on those populations of older Californians while maintaining a focus on equity, risk, and exposure is going to be key. And that's what the teams are looking at now. And we will be coming to you soon with some guidance and direction. And I believe it's going to help California a great deal to keep moving through, as we have started over the last 10 days, given the governor's challenge to focus on 1 million more vaccines by this weekend, that we will be able to use this tool from the federal government successfully to get through vaccinating the state.
Melody Gutierrez, the Los Angeles Times.
Hi, yes, thank you for taking my question. Could you just give a little bit more of a concrete answer on when you would expect these new guidance to be implemented in California, how those would be rolled out and made aware to the public, how long you would expect that to translate to when somebody would be receiving those vaccinations, if that would be immediate? And then also my other question is just in terms of right now under these tiers, when there is leftover vaccine, the expectation is that those are used for lower tiers. But does that is that flexibility all the way to anybody who's available to just ensure that nothing is wasted? Could you kind of give some examples of when that would be allowed, and if the expectation that no vaccine would be wasted regardless of who it's given to, if the only other result is to throw it away?
Yeah, so first off, we're looking at the new guidance from the federal government today. Hope to have an announcement in the next 24 or so hours on how that impacts our own state tiering system. Those will be put out by our various groups immediately, and the hope is that we can begin to implement them statewide, not county by county, but statewide, moving together as a state pretty immediately. I can't say is that, right after they come out or within a couple of days, but that is the hope. But the first step is to have our very thoughtful expert teams go through the new guidance, understand how it's going to cause us to make some changes, and then put those out there to you as soon as we can. As it relates to your question about extra vaccine, we just want to say that we should not waste vaccine. We know that our providers and those who are in charge of vaccinating are very thoughtful, innovative people, that they have access to individuals who are in those higher risk tiers, and they should do all that they can to make sure that they're giving vaccine to those who have been deemed highest risk based on our priority groups and our phases and our tiers. But by all means, don't waste vaccine. We've tried to make that message very clear. We've talked about on the enforcement side that only flagrant violations of our tiers, people who might turn to make a profit on vaccinating others, that is what we're concerned about. But if in the last hours, I heard about one clinic who was on the phone between 11 p.m. and 3 a.m. to recruit people so they didn't have to wait vaccine. And those are exactly the kind of efforts that we want to see, so that no vaccine goes to waste, that we get California vaccinated successfully in the shortest amount of time possible.
Kathleen Ronayne, the Associated Press.
Hi, Dr. Ghaly. This is kind of building off the last question. So as Melody said, we've heard examples of hospitals having extra doses and sort of scrambling to figure out how to distribute them. Do we think having these vaccine, super centers like Dodger Stadium will help, solve this problem? And do we anticipate that having those mass vaccination sites will really speed up our ability to move to new tiers? And then secondly, Joe Biden says that he wants most schools reopened by the end of his first 100 days. So with vaccinations accelerating, do you anticipate that most California schools will be open for classroom instruction in that time frame?
Yeah, thanks for both of those questions. I would say on the first, that the mass vaccine sites will certainly help us consolidate where people are getting vaccinated, allow people to have a little bit more familiar knowledge of where they might get vaccinated, and yes, help to make sure that we have less potential for waste. But that said, let me be crystal clear. Our hope is that even in the small vaccination sites, that we don't have any waste, that we have a plan in advance for getting doses to individuals. Maybe it means that those entities reach a little farther out than they normally do to try to get the most at-risk people, but people nonetheless to be vaccinated. Again, clearly, we do not want to waste vaccine. We understand it's a scarce resource. We're trying to prioritize as best we can so we can reduce the impact on those most at risk, but we do want to make sure people get vaccinated. On the second issue, again, I'll remind you, we don't yet have a vaccine for our youngest citizens, so we await for that. And yes, vaccinations are one of the tools, but not the only tool that creates a safer and lower risk environment. So how that plays out in schools, I think, will be something we continue to work on, and we will see. I'm not sure that as the governor put out last week or the week before last, a plan for supporting schools to reopen and come back to in-person instruction, that we continue to work with districts all across the state, various education entities, to ensure that we get the message out about how to implement those plans, whether it's the testing piece or the support around disease investigation and tracking transmission, or all of the other very important things like wearing face coverings, providing surgical masks for teachers, and the above. So I share the hope that the president-elect has, that many more schools will come back in person if and when it's safe, but we are busy now trying to make sure that those efforts are accelerated, that we're supporting districts as much as possible and communicating clearly. So we'll see what happens at 100 days in, but we are working hard to meet that goal and hopefully support our communities with this important piece of getting students back to in-person education as soon as it's safe and able.
David Baker, Bloomberg News.
Yes, Doctor. I wanted to ask, at this point, do we have people who are now getting the second doses of the vaccine? And if so, how many of those folks do we have? And is that something that you're going to be adding to the daily updates that the state issues on numbers?
So yes, the number I saw last night is it's about I think it's 99,000 Californians, a little over 99,000 Californians have received both shots in the series. And yes, that's information that we will continue to make public.
Catherine Ho, San Francisco Chronicle.
Hi, Dr. Ghaly. Regarding vaccination, why are we seeing other states like South Dakota and West Virginia seemingly vaccinating their residents faster and more efficiently than we are? What are they doing differently?
I think it's a good and fair question. I think part of the process that we have set up here in California, really thoughtful, trying to focus on risk and exposure and equity, have led to some delays in getting vaccine out into our communities. I think other states, I don't want to speak for South Dakota or North Dakota, people have mentioned West Virginia, a few other states. I'm not sure all of their strategies, but I will say that certain states that I know have put a great deal of effort into kind of coming up with their priority groups, watching how we keep a keen eye on equity, have been sort of in the same place where California is. And we look forward with additional vaccine to accelerating and I think really doing more in this space than we've done already.
Leslie Brinkley, ABC 7 News, San Francisco.
Hi, Dr. Ghaly. Wanted to follow up on a development in Southern California when yesterday the Los Angeles County Health Director, put out a push for people to not only wear masks when they leave their house, but asking essential workers and people who run errands for their family to wear a mask inside their house as well, to come home and mask up around the people you live with. What are your thoughts on that?
Look, this is a balance. I think it's sound science. We know that we talk about how, sort of backyard gatherings or private gatherings as a main source of spread, and so many people have pitted those sorts of gatherings against things like restaurants and other venues. But we also know that a great deal of transmission happens in household transmission. People you live with who go out and live their days, they go to work, they're an essential worker, they become infected, they're asymptomatic, and then they get a high-risk family member infected. So the same rules that help protect you in your workplace can also protect you in your household. And with such high levels of transmission in Los Angeles County, I think it's prudent to make that option available to equip people with the knowledge that it could actually protect a loved one in a way. I mean, the number of heartbreaking stories of inadvertent infection from somebody who didn't know that they were infected. They did nothing that they didn't think was okay. They came home, they took off their mask, they wore it all day at work, and then they took out their mask, and a vulnerable person in their household became infected and had a bad outcome or was hospitalized. That is a true story for so many Californians, especially in some of our communities where we have multi-generational families, even some places with more crowded conditions. So it is prudent. It does make a lot of sense from a science transmission basis. I think it does come down to how well can we continue to comply. I urge people, if you're able to, especially now where transmission is still high, to consider doing it. And I think it does make a lot of sense to make that urging in places like Los Angeles and other places where we still have very significant transmission.
Andrew Joseph, STAT.
Just on a different topic, are you all, whether state officials or hospital leaders, discussing contingency plans should B117 or another more transmissible variant of the virus takes off there? And I guess, what would that look like if you had even more transmission on top of where you're at now? Thanks.
Yeah, it's a good question, and absolutely we've been worried about it. I think we have 38 confirmed cases, many of them linked in Southern California, San Diego, and San Bernardino. I think we're continuing to look at the genomics of positive samples across the state to determine if it's anywhere else. But absolutely, it's a concern of ours. And what this means is, even as I've said before, today, activities that you did 6 or 8 weeks ago, they're riskier today. With the B117 variant, that UK variant being of concern here in California, particularly Southern California, absolutely we're worried that if it takes off, if it does become more widespread, that we're going to see even increased transmission versus where we are now. But it's the same strategies. We need to be focused on our personal behaviors, keeping our mask on, reducing our risks of transmission by staying home when we can, not spending time with people outside of your household. So it's the same things. I just think that the rates of transmission are going to be significantly more challenging to contain if we see more widespread proliferation of this UK or this B117 variant that you mentioned. It is still encouraging that vaccine is protective here, that the faster we can deploy the vaccine, the more we get into the state, the less the impact of that variant will be. But in the short run, very much concerned about it and its impact, and something we're watching closely, talking to our public health partners across the state about its impact on them particularly, and then continuing to track that transmission for additional genomics testing each and every day and reporting that out as we see new trends.
Ron Lin, the Los Angeles Times.
Thanks so much for speaking with us. We really appreciate it. Two questions. In LA County, there was an expectation this week that this is the week to monitor hospitalizations to see if we're going to see this post-Christmas surge. So is it too early to take much solace in this relatively flattening of hospitalizations? Second, now that we've had a better sense of how bad the surge has become, can you reflect on why you think the pandemic got so much worse now after California had a relatively better spring and summer? Thanks so much.
Yeah, I think it's neither too late or too early. We're just seeing the beginnings or we're probably right in the middle of when we would have expected anything pre 12/31, pre New Year's Eve, New Year's Day impact on hospitals. As I said, it's about 12 days out. Today we're on the 12th that you start to see cases show up in your hospitals. So we're right there. I'd say we're kind of in the middle. So it is encouraging to see not as significant an increase in Southern California and other parts of the state as it relates to the holiday activities and surge. But I wouldn't sort of declare victory in any way. We know we've seen a many high days since the beginning of the year. We knew that people didn't come in to get tested as frequently as they would have pre-holidays. So we do anticipate that even though this week has been encouraging because those admission numbers have been flatter, that we do still expect there to be a bump up in the middle of the month towards the second half of the month that we anticipate. So yes, pleased to see less impact at the moment, and still very prepared to see what we were worried about, which was a second half of January that was pretty concerning.
Final question, Paul Sijan, San Diego Union Tribune.
Thank you for taking my call. I had a question. It's a little technical about waivers for pharmacists who have vaccination certificates that have expired. I understand there are a fair number of these pharmacists out there. I've heard that the state is considering a waiver that would allow them to, for a certain small period of time, come forward and just start helping grow the ranks of vaccinators. Is that something the state's considering, and when might that happen?
Yeah, so I'll have to get back to you. I'm not sure where that is in the level of consideration. I know that concept, as well as others, have been considered. I think we know that ramping up our ability to not just have vaccinators, but the support around the vaccinator to get through vaccines quickly is going to be important. So whether it's looking at nursing students and inviting them to participate in the vaccination effort, to pharmacists and pharm techs, and dealing with licensing issues for those who maybe need to become current or have retired, that all of that is on the table and something we're working on. But I will certainly get back to you, have the team get back to you with a more complete answer specific to your question. So again, I just want to thank you all for bearing with us. I know we went through a lot of information, hopefully got through many questions and provided some clarification. I know that there's a lot of focus, and it's our focus too, on vaccinations, that as we balance the work around surge and the hope that we reduce its impact in Southern California and other parts of the state, San Joaquin Valley, we see those trends start to flatten. And hold on to those flattenings, that we then continue to pivot the focus on vaccines. And with today's news and our hope that the real work that our teams at the state level, updating you very soon on how that will impact our own prioritization. We know that every Californian is wondering, we get your cheers, we hear your phases, but where do I fit in? So more news on that point as well soon. So with that, thank you all for your tremendous work, staying strong and together, getting through what has been a very difficult and dark time. To the families who have lost loved ones, my heart and thoughts are with you. And as we continue to move down towards the other end of this pandemic, look forward to engaging with you and keeping you updated as much as I'm able to. Thank you.